Hi guys, welcome back to my channel. If you're new here, welcome. It's been quite a bit of time since I last posted. My goal is to be consistent and post a video once a week, but sometimes between a full-time job, 2 toddlers, and a 24-week pregnancy, it can just be a little hard to always get a video out. But I'm going to try to be a little bit more consistent. I have a lot of really great ideas for videos, and I have a really exciting collaboration coming up soon. So thank you so much for sticking around. So today's video is in response to a comment that I got on YouTube. Can you do a video on MEN1 syndromes? Please, I was just diagnosed with MEN1. I have stage 4 NET cancer. That stands for neuroendocrine tumor, and would love to be able to share a video about it with friends and family. So that's what this video is about today, MEN1 syndrome. So if you have any questions about hereditary cancer, or there's anything in particular you'd like me to talk about, you can leave it in the comments below, or you can send me a message and maybe there's a chance that I'll make a personalized video just for you. So today's video is about a really rare syndrome. Multiple Endocrine Neoplasia Type 1 is estimated to affect somewhere between 1 in 10,000 to 1 in 100,000 people, depending on the population. There are some populations where it's a little bit more common, but overall it's really rare. And a lot of doctors won't even see this at all in their careers. In genetics, we do see this more often than in a non-genetics field, but even in genetics, it's not very common at all to see this. So most of the videos on my channel are about topics that are a little bit more broad than MEN1, but I did want to make this video because there's so few resources for people out there who have this syndrome. There's a couple of videos on YouTube, but in terms of like a patient support group, there's nothing like that I could find. So let's dive into it. So MEN1 is a syndrome that was described in 1950 by a doctor named Paul Wermer. So sometimes it's also known as Wermer syndrome. And multiple endocrine neoplasia basically means that you can develop multiple abnormal growths. Neoplasia means abnormal growth of tissue in the endocrine system. So the endocrine system is our body's network of glands that produce hormones. And having MEN1 means you're born with a predisposition to develop tumors in these glands. So one easy way to remember the most characteristic tumors are the 3 Ps: the parathyroid gland, the pituitary gland, and the pancreas. So let's start with the first P, the parathyroid. This is the gland that is most commonly affected for people who have MEN1. In fact, by age 50, almost everyone who has MEN1 syndrome will develop some abnormal growth in the parathyroid glands. The parathyroid glands are 4 glands that are right behind the thyroid, and their role is to produce a hormone known as the parathyroid hormone, which helps to control the amount of calcium that we have in our blood and our bones. So if you have a tumor in the parathyroid glands, that increases the amount of parathyroid hormone that is being produced. You basically have a situation where you have an abnormally high amount of calcium in the blood and the bones, and that can lead to a lot of different problems. It can lead to feeling depressed, lethargic, confused. In terms of GI symptoms, it can cause constipation, nausea, loss of appetite, or vomiting. It can also cause kidney stones. So sometimes one of the things you see in these families with MEN1 syndrome are people who report a long history of many kidney stones. So the high calcium can cause kidney stones, can cause frequent urination, and it can also cause dehydration. There's also a higher risk of bone fractures, high blood pressure, and abnormalities in the heart rhythm. So usually parathyroid tumors that are causing hypercalcemia are treated with surgery. Now moving on to the next P, that is the pituitary gland. The pituitary gland is a gland in the brain that is also known as the master gland because the hormones that it produces are used to control the hormones that are produced by other organs. So if you have a tumor in the pituitary gland, depending on which hormones are being overproduced, that would lead to different symptoms. And sometimes pituitary tumors don't produce any hormones. Those are called non-functioning tumors, and the symptoms that one would get are more from the growth of the tumor itself. So it can lead to frequent headaches and visual disturbances. But let's talk about the ones that are functioning and are producing hormones. So there are 5 different types of hormones that can be produced by the pituitary gland. So if a pituitary gland is overproducing a hormone called the thyroid stimulating hormone, or TSH, then you will have a condition called hyperthyroidism. And that can lead to symptoms such as feeling nervousness, mood swings, you can have a tremor of the hands, a rapid heartbeat, and you can have diarrhea and weight loss. If you have a pituitary tumor that is overproducing a hormone known as the adrenocorticotropic hormone, or ACTH, this is a hormone that controls the level of a different hormone known as cortisol, or the stress hormone. And if you have a long-term overexposure to cortisol, then you can have a condition known as Cushing's syndrome. And in Cushing's syndrome, people have a very characteristic look. They can have fat deposition in the face, so they would have a very round face. They can have fat deposition in the back of the neck, so that would lead to a hump-like appearance. And they can also have these very characteristic purple stretch marks over their belly. And Cushing's syndrome can also sometimes lead to high blood pressure, bone loss, and sometimes type 2 diabetes. If somebody has a pituitary tumor that is overproducing the growth hormone, then you can have a condition known as acromegaly, which is an overgrowth syndrome, mostly of the face and the hands and feet. And actually, Tony Robbins, who's a famous motivational speaker and life coach, has this condition. He's really tall. I think he's like over 6'5", and he has a bigger face than normal, bigger hands than normal. And it's been said that his acromegaly is due to a pituitary tumor that he had as a teenager. The most common type of pituitary tumor in MEN1 syndrome is known as prolactinoma. And that is a tumor that is secreting a hormone known as prolactin. And this can result in spontaneous lactation in women. It can cause women to have decreased menstruation or no menstruation at all. And it can also cause infertility for both men and women, as well as erectile dysfunction in men. And the last type of pituitary tumor is one that is secreting either follicle stimulating hormone or luteinizing hormone. These are hormones that stimulate the gonads, so the testes and the ovaries. And if somebody has one of these type of tumors, then it can result in early menopause or low testosterone levels. And depending on the type of pituitary tumor that a person has, the treatment would be either surgery or medication. Okay, moving on to the third P. The third P stands for pancreas, and this is the most dangerous of the 3 Ps. Within the pancreas, there are many different types of cells. The main ones that are involved in hormone production are known as the islet cells. And there's many different types of islet cells. Depending on which type of islet cells are affected in a tumor, that would result in different hormones being overproduced and leading to different types of symptoms. And again, sometimes we have some pancreas neuroendocrine tumors that are non-functioning, are not producing any hormones, but they just become evident because of the actual growth of the tumor. But let's focus on the ones that can produce hormones. So one of these types of tumors is known as gastrinoma, and that is where the tumor is overproducing a hormone known as gastrin. And gastrin helps to regulate the production of acid by the stomach. So if somebody has a gastrinoma, they can present with a condition known as Zollinger-Ellison syndrome, which basically manifests as diarrhea, upper abdominal pain, reflux, and ulcers. Gastrinomas can be malignant. Another type of pancreas neuroendocrine tumor is the insulinoma. So insulin is the hormone in our body that helps to decrease the amount of blood sugar. And if somebody has a tumor that is overproducing insulin, it will basically lead to hypoglycemia, or very low levels of sugar in the blood. And that would manifest with feelings of hunger, lightheadedness, passing out, irritability, pretty much how you feel if you're really hungry, but long term. The good news is that most insulinomas are usually benign. Now, the opposite hormone of insulin is glucagon. Glucagon normally helps to increase the level of sugar in the blood. So if somebody has a tumor that is overproducing glucagon, they will have higher than normal levels of sugar in the blood, called hyperglycemia. And that can lead to loss of appetite. You can have anemia, diarrhea, blood clots, and there is a very characteristic skin rash, usually of the lower legs. And if somebody has this rash, it can be assumed that they might have a glucagonoma. So the majority of these glucagonomas are malignant, cancerous, but fortunately they usually grow quite slowly. And the other hormone secreting pancreas neuroendocrine tumor would be something called a VIPoma, or vasoactive intestinal peptide secreting tumor. What that does is it basically accelerates the intestines. So that can lead to watery diarrhea and loss of electrolytes. So that's known as WADA syndrome, watery diarrhea, hypokalemia, which is low potassium, and achlorhydria. Achlorhydria is a change in the pH of the stomach. And these tumors can also be malignant. So we've covered the 3 P's, the parathyroid, pituitary, and pancreas. Let's move on to other types of tumors that can also be part of MEN1. One of these is a type of neuroendocrine tumor called carcinoid tumor. And these are tumors that can happen in many different parts of the body, including the pancreas, in general the gastrointestinal tract. It can happen in the lungs and in the thymus. And smokers who have MEN1 are at higher risk to develop carcinoids. And the treatment for these tumors is usually surgery. You can also have a tumor growing in the adrenal glands, and these can either produce hormones or not. And surgery is also sometimes required if the tumor gets really big or if it's growing really quickly. And aside from these 2 tumors, you can also have tumors that are usually benign that can grow on the skin, such as angiofibromas, collagenomas, lipomas, those would grow right under the skin. They're fatty tumors. You can have meningiomas and ependymomas, which would grow in the brain or the spinal cord. And you can also have leiomyomas, which are tumors of the smooth muscle. So as you can see, there's a huge spectrum of tumors and cancers that can happen in people who have MEN1 syndrome. You can have tumors that secrete hormones, others that don't secrete any hormones. You can have tumors that are benign, like they don't have the potential to develop and grow and metastasize, and then you have tumors that can be cancerous. So the spectrum of disease is huge, and that's why sometimes it can be hard to pick it up in a family, because in one family you might see somebody that presented with a history of kidney stones, and somebody else who had Cushing's syndrome, and somebody else now who's been diagnosed with a pancreas neuroendocrine tumor. So because of the variety of manifestations, sometimes it can be really hard to pick up this condition, especially since it's so rare and it's not something that you think about every day. But it is really important to identify this condition in a family, because if we know that there's MEN1 in the family, then we can set people up with screening and try to detect tumors before they start causing problems. So that brings me on to the genetics of the syndrome. MEN1 is a condition that is autosomal dominant. That means that both men and women can be affected by the condition. If somebody has the condition, then they have a 50% chance of passing it on to each child, and their siblings also have a 50% chance of carrying it. And typically this is something that is inherited either from mother or father, but about 10% of the time it's just a condition that happened for the first time in this person. Like there's an error that happened in the MEN1 gene at the time that they were conceived, but it's not something that they inherited from either parent. But then once somebody has it, they can pass it on. So this condition can actually be diagnosed without doing any genetic testing. If somebody has 2 of the 3 P's, then they are said to have a clinical diagnosis of MEN1. And if there's a known family history of MEN1, then simply having 1 of those 3 P tumors is enough to strongly suspect that this person also has MEN1. So genetic testing is not actually needed to make a diagnosis, but genetic testing is very important for one particular reason. And that is that if we know, for example, that you have MEN1, we would want to know what particular mutation you have within the MEN1 gene, because if we can identify the specific mutation, then we know exactly what we need to test your children for. Let's say you have 3 children, and hopefully not all of them will inherit the mutation. But if we know what mutation you carry, then we know what to test your children for, and only the ones that have inherited the mutation would need to be set up with screening. So as long as we know the specific mutation that you carry, then genetic testing is very easy for your relatives. Genetic testing is simply done with a blood or saliva sample. And this is a condition where we actually talk about doing genetic testing for children, usually around age 5, because that is the age at which sometimes tumors can start to develop, and that's the age where some screening is recommended. And in terms of screening, usually it's recommended for people with MEN1 to be followed by a specialist who is familiar with MEN1 or a team of specialists. And screening usually involves blood work to look at the different levels of hormones in the blood, as well as screening through imaging like MRI or CT scans. So as you can see, this is a complicated condition, but we do have screening options in families where the condition has been identified. So hopefully you found this video helpful. If you have MEN1, I know that there is not a lot of content out there. There's not a lot of support groups. There are a couple of videos on YouTube, and hopefully this one has helped to further your understanding. If you are a healthcare provider or you're studying for a genetics exam, hopefully this helps you to wrap your mind around this syndrome. If you like this video, please give it a thumbs up, and please subscribe if you want to see more content like this. Usually my videos are a little bit more general, so about genetic conditions that are slightly more common. And hit the notification bell if you don't want to miss any of my videos. And stay tuned for next week. I have a really exciting collaboration coming up. It's going to be all about what it's like to be a genetic counselor. So stay tuned for that. Thank you so much for watching, and see you next week. Bye.